I'm Dewyani Chowdhury. I'm a pediatric cardiologist. I work in central Pennsylvania. I have a small practice. The uniqueness of our practice is that we are able to offer very low-cost care to indigent population. So I'm the cardiologist so-called for the Amish community or the anabaptist population. So we see about 4,000 patients a year in our practice every day, and it's a very busy practice. We have 4 other outreach clinics within central Pennsylvania. So we love what we do, and we like being where we are. So we had a child who came to the office and was asymptomatic actually, and we did an echocardiogram. And thanks to this machine, we were able to diagnose a major anomaly of the aortic sinus, and the patient needed heart surgery. Now, if we had missed this diagnosis, this is a patient who probably would have never made it back into the system to get another echocardiogram. And if we missed that, then this child would have presented as a young adult with a major problem or even sudden death. So I think having perfect imaging, good imaging, seeing details is very important. We've been able to diagnose a lot of coronary anomalies. We've been able to use e-flow very effectively in patients. So we even have images where we have compared the echo with the CT coronary images, and the z-scores matched to the second decimal place. So we are extremely happy with the imaging that we have now, and it just feels like we have a higher standard. So when we look at other images, we kind of feel disappointed because we can't see what we need to see. And very excited about the new technology that it brings. So the strain is really good, which I know is on a lot of machines, but the way the strain is displayed, very helpful for us. Then the vector flow map, we are trying to understand genetic cardiomyopathies through that. We have a very large, again, an Amish population, so we see a lot of genetic disorders. And the e-flow, I think, has really helped us with coronary imaging and also branch pulmonary artery imaging, because we have complex congenital patients with tetralogy of Fallot, where a lot of times patients would need MRIs because you cannot see the branch PAs. But we have avoided MRIs in our patients because now we have LISENDO and the e-flow. Even in a 300-pound patient, we can get those images. So we are just totally in love with this machine. We also do great fetals on that. So we've used e-flow on fetals too, and we've been able to diagnose very complex hypoplastic left heart very accurately because our imaging is very good. And we are a small practice, so we have to send our images to other programs when we refer our patients. And all the tertiary care programs in our area always compliment us on our imaging. So I really think the machine's really serving us well. Thank you very much. One more great feature of the machine is that my echo techs absolutely love the probes. They're very light, so if I ask them to add extra studies, they're not complaining about their wrists, and they actually just love working on the machine. So the probes are amazing. Thank you.